Chavez, we talked about missing teeth, and you did very well explain that it's not the end of the world right away, but over a long time, for some people faster, for some not so fast, they can create havoc, in quite some area. You explained that well. Now, give us especially with all the new stuff which is coming out or has come out over the last 20 years, which you mentioned, the advances, give us the 2 or 3 main ways with which we still currently replace missing teeth. Just give us an overall picture without going into too much detail in each, otherwise we'd have to go to 8-year dental school. Just give us a nice little picture. What are the 2 or 3 ways we can fix that, and why is in some cases one a little better than another one?
Yes. Today there are 3 basic ways to replace teeth. First, and my least favorite, is a removable appliance. So a removable denture. You maybe remember that maybe grandma in your case and in mine at night would take either her entire teeth, that's a full denture, or some of the teeth, brush them and put them in a jar. And as a kid, I remember walking in the bathroom and seeing that and was just horrified by that look. Well, we still unfortunately have that, and fortunately for some people, because for some people that's the only option that they can afford. It's certainly the most affordable of the options. It's my least favorite, and it's my least favorite for multiple reasons. Number one, if we're talking about a removable partial, a partial has to hook on to adjacent teeth. And when that happens, you're an engineer, so you'll appreciate this. All the forces of mastication, or at least many of the forces of mastication, are transferred to the adjacent teeth where the hooks are. So as you eat and chew, the partial, which is a removal device, will slightly move within the jaw and within the mouth, up and down. You've got these hooks on the adjacent teeth. And guess what they're doing? They're continuously trying to extract, really, the adjacent teeth. So they end up stressing the adjacent teeth, and many times you end up accelerating the death and the premature loss of the adjacent teeth that those hooks were made on. So this is my least favorite. It's also more cumbersome. There's a lot of hardware in the mouth. Sometimes people have problems with taste. Sometimes people have problems with speech. They're always having to take this out every time they eat something. Have to take it out.
Never mind the feeling. Sorry to interrupt you. Never mind the feeling of being old grandma, because that's the picture you get in and out, right? So
right.
I can see why not. What's your next option?
Yes, next option
or another one.
Sure. The next one would be a fixed bridge. All porcelain nowadays, more and more. And this is certainly an aesthetic restoration, and it's fixed in your head. So it's actually glued in, and it functions basically like it used to function before you lost your tooth. But of course, once again, you for instance, you have a missing tooth, and you got the 2 teeth on either sides. There are now the support for the missing tooth. Now this is all glued in your head, and you don't take it out. You don't put it in the cup. But at the same time, you don't floss it like you used to floss. You have to use a special floss. And you will always feel that you get food caught underneath the missing tooth. No matter what happens, you will always get food caught there. And you'll always be trying to clean the area of the missing tooth, because you'll always get a little bit of food caught between the gum and the tooth. But it works well, and if you're fastidious with your hygiene, there's no reason it couldn't work for many years well. But it does stress the adjacent teeth a little bit more, because you have 2 teeth doing the work of 3. And of course, you've got to be very, very fastidious with your hygiene. Because if you're not, you're going to accelerate the need to replace the bridge. My next and my favorite, and what I believe to be the golden standard or the ideal standard of care, at least in my practice, would be a dental implant. Basically, just to keep it simple, it's a titanium screw that is very carefully and placed in the area of the missing tooth. And then it's allowed to integrate into your jawbone, and then we get the crown on top of that. And that tooth will function just like your normal dentition. You'll be able to floss it just like a normal dentition. And this really, really is an amazing restoration. We get to, in many ways, get you back to where you were prior to losing that tooth. And they have a very good success rate. Like anything else, it can still fail. I mean, the tooth that your mom and dad gave you failed. But this has, of all the restorations in dentistry, probably has the longest longevity, and by far, in my opinion anyway, the best restoration for a missing tooth. In some cases, we may not go there, especially in an aesthetic area where it may be harder to guarantee aesthetics, but by and large, it's the best restoration.
So, when you do a bridge, a fixed bridge, 2 units, 3 units, basically you have the 2 teeth, which you grind down, put a tooth over it, a crown, and hang whatever in between. And you say that there is then, because it's almost like a welded thing together, so you don't have 3 teeth anymore. You have one big tooth shaped like 3 teeth.
Correct.
And then you need to do. So me, like when my wife and me go to the bathroom at night, I brush, I floss, I shower, I shave, and she's still flossing. So I would be this lazy guy, this slappy guy who probably would create a little bit of gum disease. And again, you mentioned gum disease in another section of our interview to be one of the most devastating things a person could have for the whole body, not just for the teeth. So is that gum disease thing, not just for the whole body, but also for making the bridge failing a little faster? Are those the reason why it might fail faster than an implant where you use, as you said, the titanium, the same thing they use for hip replacements and stuff like that? Is that one of the reasons why it is that you can't do the hygiene so great?
Yes. Well, poor hygiene can lead to gum disease. We now know that periodontal disease has a strong genetic marker to it. So gum disease has 2 components. You can acquire gum disease by not really brushing and flossing fastidiously, or you can, and which is really most the case, you have a genetic predisposition for gum disease.
We're gonna stay now. We're gonna stay now with just how it is relating to the bridge, as you have talked.
I'm gonna get there. Concerning gum disease and bridges, if you have gum disease, you will be losing bone support. And if you have a bridge, you're having 2 teeth, which are doing the work of 3. The 2 teeth are more stressed because they're doing more work than just what they were intended for. And if you have gum disease, which means you have a propensity for bone loss, you really run the risk of accelerating the loss of now those 2 teeth. So you can go from losing 1 tooth to losing 3 teeth because of the gum disease. So it's very, very important, especially if you have a bridge, to make sure you don't end up with gum disease around those teeth. And the other reason you can lose a bridge is just because it's hard for you to floss. It's harder for you to floss. You don't floss up and down. You have to clean underneath it. If you don't clean it underneath it fastidiously, you reform decay, and then you have to remove the bridge and have another bridge done. So those are the two principal reasons why people lose bridges. Fixed bridges.
Let's talk a little bit about it in big thing in terms of finances. So it looks to me like if a person has only 1 tooth problem and he needs to grind down a couple teeth next to it and then put 3 crowns on it, is that really a lot cheaper than just 1 implant?
Actually, no. It may be a little cheaper. You may be dealing with a 20% differential, but not more than that. I can only talk about my practice, but I believe in the community in general, there's maybe today a 20% differential between a 3-unit bridge and a single implant.
And for that you get something with
the benefits of the benefit between the two is far more than 20%, in my opinion.
Right. Is there actually a number? Because the implants, especially as good as you make them now, might not be around so long. Do you have a relative time frame of how much longer they hold? Because if they break down, let's say 15 years versus 30 years, right there, I mean, you're ahead of the game. Never mind not having to go through the surgery, again.
Yes, in dentistry, we're very loath to suggest a time frame or warranty that a crown will last 5 years or 7 years or 10 years or an implant's going to last you 20 years or 30 years or a lifetime. The most recent study that I'm aware of suggests that for every 10 implants that you have, you will probably lose 1 implant after 10 years, which is actually which puts it definitely in the Rolls-Royce restorations in dentistry. There's nothing else man-made that has that type of shelf life. Nothing comes close.
Okay. So, so if a person, however, has, let's just say, a missing tooth and the teeth next to it are not all that great in the first place, they're already having huge cavities and stuff, and you put now, a bridge and a crown, grind them down anyway, now he might be coming off cheaper than doing 3 implants for that because he didn't really need to move them yet, and he can delay a larger money outlay for a while, maybe even a long time, by putting on a bridge and a crown. Are you with me what I'm saying?
No.
So let's just say a person doesn't only have a missing tooth and you need to put an implant in it, which is almost the same price than doing a bridge where you have to grind down the next tooth and put a crown. But let's say those next tooths, the teeth next to it are already fairly broken down and need some work anyway. Would that be a reason to then go, let's do a bridge because it's a lot cheaper in this case than doing 3 implant? Or is there still a reason to go for 3 implants, more or less?
Yes. Well, it's a value judgment. What I can do as a clinician is explain as detailed and in as simple terms as possible what is happening in the patient's mouth, what are their needs, and what are their options, and then also explain to them the costs associated. And then it becomes a value decision for the patient. Certainly, if a patient has a missing tooth, but the 2 teeth on either side, for instance, both really needed crowns, okay? If you do a bridge, it's really 3 crowns. It's a crown on the tooth on either side of the missing tooth, right? So in that case, the patient may make a value judgment and say, doctor, I don't want to pay for a crown, an implant, and a crown. I'd rather just do a bridge and take care of the other 2 issues and the missing tooth with one solution. I know it's not as ideal. I know it's not as long lasting, but my financial situation at this point in time in my life requires that I harness my finances carefully, and this would work best for me. That's certainly a very reasonable approach and solution to that patient's problem, and it's very acceptable. There's nothing wrong with that. You've got to understand, all these things meet standard of care. What we're talking about right now is, do I want the Rolls-Royce, or am I happy with the Toyota, or they all are vehicles. They all are safe. They all have airbags. They all will get you there, and it just depends on what's your personal preference for yourself.